break through that addiction denial and say, this is not a small problem. You really need to be able to, you need to tackle this. You need to be able to look at it. So when we start to look at this as clinicians, and we start to look at someone who's comes into the office, they think I have this problem. There's like three main areas that we look at. We look at the consequences of the behavior. For a lot of times, the person is doing this behavior. There's consequences, yet they keep doing it. They know the consequences there. They know the risk is there, yet they continue to do it. They may have lost a job, and then on their next job, they're doing the same behavior again. At employment, if they're looking at pornography, they've already got fired once, and they go, oh, I'm never going to do this again. And here they are doing it again, and the consequences are there in their life. Losing a relationship, they've maybe have been threatened several times with the loss of a relationship, yet they keep doing it. They may have a sexually transmitted disease, yet they still continue to do it. So you really get to see this domain of consequences. Their sexual behavior has impacted their life in some negative way. And the other area that we look at is the efforts to stop or control that behavior. So one of the things we see with them is that when we start to ask them questions, to talk to them a little bit more, we begin to see that most likely they've made promises to themselves that they would stop. They've said, on this date, this is the last time, I'm not going to do this anymore, yet they're still doing it. They, right down to where we've had people that have hurt themselves in an efforts to try and control their behavior. So it's they have all these failed efforts to stop, to try and control it, and yet they can't seem to do it. So they really feel very, very powerless and very out of control because of all these efforts to stop. And then another is that they use this behavior. They use sex as a way to feel better. So I can't sleep, but if I'm sexual, I can go to sleep. I'm having stress in my life, but if I look at pornography, I don't have to deal with that stress.